I've got a father-in-law who's developing dementia, but is having significant personality and behavioral changes. Does he have frontotemporal dementia? You know, when I think about Pick's disease or frontotemporal dementia, I think about Bruce Willis. I don't know anything about his case, but it's all over the media. He's just one of my favorite actors. You know, when he was younger, I didn't really care for him that much, but when he got into movies, you know, he was sort of like a John Wayne. When he had a movie, I would watch it. And he just seemed like a great guy, seemed like a great father. And he has frontotemporal dementia. And I want to shout out to Demi Moore, his ex-wife. You know, I'm proud that you've come back to help. And so many times this extended family is so necessary in people with frontotemporal dementia because it's a little bit different from your Alzheimer patient. It begins at a younger age, and many times it starts with prominent frontal lobe signs such as behavioral changes. They start dissociating from family, have very poor social contact. They breach etiquette and just do some gross things in front of other people. They can be very vulgar, very tactless. They're also disinhibited, you know, just drop their britches at church, you know, just do some crazy stuff, just a complete loss of frontal lobe inhibitions in many cases. You know, there was a day a couple of weeks ago I just wanted to slap somebody, you know, but my frontal lobe's working very well, and I told my wife I just wanted to slap that person, but you know, my frontal lobes just prevent me from doing this. Well, they lose that frontal lobe, that area that helps you control yourself. The diagnosis is generally based on, you know, personality changes, and then later on, if you get lucky, you'll see severe frontal lobe and temporal lobe atrophy. They have these large balloon-shaped pick bodies at autopsy. They're very large brain cells that are full of aggregates of protein. A PET scan can be classic if you can get a PET scan. You know, here, you know, in Asheville, you know, you have to drive to Chattanooga to get an amyloid PET and pay over $1,000 cash. Unfortunately, you know, frontotemporal dementia, what we used to call Pick's disease, rapidly progresses to death in 8 to 10 years. So it differentiates from Alzheimer's. You see it in younger people, and it rapidly progresses to death fairly quickly. The changes in the personality help doctors to delineate between Pick's disease from Alzheimer's disease. In Alzheimer's, you get memory first. Pick's disease or frontotemporal dementia, you often get personality changes first. That's the way I like to think of it. Personality changes first in frontotemporal dementia. Memory changes first in Alzheimer's. So that's frontotemporal dementia. And Bruce, I want you to know all of us, and there are millions of us praying for you and your family. Stay the course. You've given us a lot of joy over the years, and we thank you for that. This is Dr. Caudle Miller, the Brain Doctor. Like, comment, subscribe. I do answer all the comments within 1 to 3 days. More later.